Back here in Lagos, Nigeria, hawking of drugs on the streets and the sale in the open market may soon be things of the past, as the Director General of National Agency for Food and Drugs Administration and Control, Mojisola Adeyeye, says the agency is collaborating with state governments and the Ministry of Health to build drug malls for proper monitoring of their distribution in the country. Professor Adeyeye, who spoke on the plans at the biennial national conference of the Association of Lady Pharmacists in Lagos, said the culture of strict monitoring of drugs distribution in the formal sector must first be put in place. Sarah Yeko reports.
This is the 15th biennial national conference of the Association of Lady Pharmacists, an interest group of the Pharmaceutical Society of Nigeria, with the theme Pharmaceutical Value Chain for Optimal Utilization. Where are we? The female pharmacists examine the weak nature of Nigeria's drug market and how women can rightly position themselves in the industry.
Lady pharmacists are working in trenches in every practice area of pharmacy and extending beyond to excel in other areas for the greater good. Whether we interrogate our topic from a product or practice perspective, there is much to be said about our theme.
From the initial development stage of medicines to the final appropriate use by patients, every arm of pharmacy is expected to play a role and add value to the chain.
The keynote speaker, Claire Omaseye, lamented over how health workers operate in silos, undermining the effectiveness of service delivery and patients' care in the pharmaceutical value chain.
COVID-19 showed us that, in fact, if we had another few months of it, we would have run out of the major pharmaceuticals in our country. Why? Because 70% of our drugs are imported. But the hard reality has to be said. I spoke to a lot of pharmacists before coming here, and a lot of pharmacists said that they feel that they are over-regulated, that they don't mind to be regulated, but if they're going to be regulated, then regulate those charlatans too.
Responding to the address, the Director General of the National Agency for Food and Drugs Administration and Control, NAFDAC, Professor Mojisola Adeyeye, said the open market is an inherited problem which the agency is trying to eradicate.
It is right that we regulate a lot of the former, but we have to start from somewhere. If we don't regulate the former, then there's going to be problem with the informal. Open drug marketers will no longer be, but it takes a lot of money to build the drug malls.
Some recommendations made at the event to help the drug market include streamlining the number of drug importers. Most importantly, participants urged pharmacists to partner with regulators and demand the full implementation of the National Food Drug Guidelines, a legislation that can sanitize the disorganized and fragmented market. Sarah Yeko, TVC News, Lagos.